The arms are by the sides of the body, and the legs provide the base. Muscles work. There is interplay between the flexors and the extensor of the knee to balance. The femora vertically on the knees, quadriceps plays a key role in balancing. The body, extensor of the hip and the flexors of the lumbar spine work more strongly to maintain the correct angle of pelvic tilt. Muscle work of the rest of the body is same as that of standing. Effect and uses. The cog is high but lower when compared to that of standing. The line of gravity is close to the edge of base, however, uncomfortable for most of the people. The pelvis is fixed because the origin and insertion of rectus femoris are further apart so that the muscle is more on the stretch. This is used as starting position for back movement and to train control of hip, joint and lower trunk in preparation for standing. Because the muscles of the feet and leg do not take any share in maintaining the position, the effect of a movement done in this position will be more definite and purer than if done in standing position. Sitting position. The position is taken on chair or stool. It is preferable to leave 2 or 3 inches of space between the back of your knees and the edge of the seat. The height and width of seat must allow the thighs to be fully supported. The hips and knees are flexed to right angle. The knees are apart and feet rest on the floor. Your weight should be evenly distributed on both buttocks, chiefly on the tuberosities of the ischium. Muscles work. There need be no muscle work to hold the position of the legs as they are fully supported. The flexors of the hips work to maintain a right angle at these joints and to prevent the tendency to slump. The working muscles for maintaining the position are principally the neck, back, and posterior shoulder muscles. Effects and uses. Comfortable, natural, and very stable position for many non-weight-bearing knee and foot exercises. General steadiness in this position is considerably greater than in the previous positions because the base is larger. B. The cog lies nearer the base. C. Gliding in hip, knee, and ankle joints has no disturbing influence. The pelvis is also firmer because it rests on the supporting surface. The leg muscles work little, if at all, to maintain the position so that movements are purer. For all these reasons, the sitting fundamental position and its derived positions are much used in medical gymnastics. Lying position. Position. Body is supine with the arms by the sides and the legs are straight. Body is completely supported. Low. Center of gravity and highest stable. Muscle work. As the whole body is completely relaxed on the floor, there is very less muscle work. If the body is relaxed on a hard surface, such as floor, the head rolls to one side. The lumbar spine is hollowed because of the tension of structures lying anterior to the hip joint, and the latter fall into a position of lateral rotation. Head rotators of both sides work reciprocally to stabilize the position of the head. Extensor of hips and flexor of lumbar spine work to combat the tendency to hollow the back. Medial rotators of hips work to keep the leg in neutral position. Effect and uses. It is an easy position, and as the trunk is relaxed and fixed by its own weight, suitable position for many exercises. Spine is relieved from the burden of transmitting weight of head and shoulders. The position is unsuitable for those suffering from respiratory and cardiac conditions. Unsuitable for elderly because it hinders Return of blood from head. Hanging position. Body is suspended by grasping over a horizontal bar. Arms are straight and shoulders are wide apart. Head held high and the scapulae are drawn down. Trunk and legs hang straight. Heels together and ankles are plantar flexed. Muscles work. The flexor of the fingers works strongly to grasp the bar. All the muscles round the wrist work strongly to reduce the strain on the joints. The flexors of the elbows work to reduce the strain on the joints. The adductors of the shoulder work strongly to lift the body on the arms. The depressors, retractors, and medial rotators of the scapulae work strongly to fix the scapulae. The prevertebral and posterior neck muscles work reciprocally to maintain the position of neck and head. The flexors of the elbows work to reduce the strain on the joints. The adductors of the shoulder work strongly to lift the body on the arms. The depressors, retractors, and medial rotators of the scapulae work strongly to fix the scapulae. Effects and uses. Only suitable for whom muscular strength and body weight is well balanced. The weights of the shoulder is taken up by spine. Weight of legs exerts traction up on the body. During hanging, if the chest is fixed in inspiration, it may cause difficulty in breathing. Thank you for watching.